This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. So when I see a man who's had a sperm test done and the levels are lower than we'd like it to see, then one of the questions I always ask is, have you had a recent flu or COVID infection? And very often that's the case. The good news is that those cases, almost all of them, over a period of 3 to 6 months, will improve if that was the cause. To find out whether it's the cause, or at least to find out whether it's possible that the sperm count is going to come back, we measure hormone levels, and what we are looking for is those pituitary gland hormones. If they're in the low levels, almost certainly there's going to be recovery as those levels rise and they return to their previous function. If, however, the sperm production is low and the pituitary hormones are very high, then we have a problem that's probably not related to the COVID, not related to the disease that they may have suffered. It is that there is basically a production line problem within the testicle. To date, nobody has shown that production problem, that production line problem, is caused by COVID itself. As I said earlier, there is some evidence of binding of the COVID virus to parts of the sperm, which may impact on its normality. But as yet, there's no evidence of long-term impairment of fertility with COVID. A similar story holds in relation to the female and her eggs. They can be switched off by severe infection, similar to the male. So if you have had COVID and significant symptoms over a longish period of time, like the cough and like fever, in other words, you've been unwell and you're trying to get pregnant, it's probably worth getting your sperm checked and having those hormones done if there is a low count found. We do that through IVF Australia. Just get your GP to refer it to us. We can take you through that process just to be sure that COVID hasn't had any impact on your potential fertility.